Hey y'all, it's Portia back with another video. I wanted to give a update about my adult health 1, the class, and my clinical experience, which is an adult health 1. So I recently finished my adult health, which I'm looking at my computer over here. I had to hand in my concept map. So when you're in clinical, you have to do a concept map on a certain patient. I showed y'all that in one of my videos. The paper that I printed out, you submit it online. So, but I just like to print stuff out because I like to write stuff down. But yeah, so I finished my adult health 1 on October 1st. It is the 7th, so a week, like 6 days ago. I did my OA before I went to clinicals. Hear me out. The reason why I felt like I wanted to do my OA first, because I don't know, I just felt, I'm glad I did, because I wanted to get the OA out of the way prior to clinicals, because I wanted to focus on clinicals, right? And then you have your concept map on top of that. And if you don't do it right, if you're missing, even if you're missing a certain word and you didn't word it right, they will send it back. I got mine sent back twice from the evaluators. So they do not be playing games. Term 2 for me, and I just want to give y'all a timeline from when I finished everything. So I started my second term May 1st, and it ends October 31st. So I finished health assessment first. I finished that on June 13th, so a month in. And then I did my intrapersonal leadership, which is like another paper class, July 8th. So I did all that before I went to basic skills, which is your lab. And I did that July 28th. They put up my stuff quick, like, because I was still in Florida. After I passed my skills, it popped up like the same day. I got the green check mark, so that was nice. And then adult health, October 1st. So now my term is actually complete, but me being the go-getter that I am, I decided to move up scholarship and practice, D219. But now you girls regret it. I guess I shouldn't say I regret it, but I just have been very unmotivated to do this class. It's another paper class, so I'm like, I don't know, I just feel like I gave myself too much, because I would have been chilling right now. I would have been done with my term. I would have got my woot woot hooray in my portal, but I decided to add this. So now I'm working on this paper, and now I feel like it's crunch time, because I want to finish early, because if the evaluators kick it back, I gotta, fix it in a timely manner. So I'm kind of a little stressed out about it. But hey, when I finish it, and then when I go to term 3, I only got 3 classes, which is my intermediate lab, women's and children's, and adult health 2. And those 2 classes are clinical. I also want to talk about what I really didn't even use in clinical when I brought. So I did use my iPad towards the end. I didn't use my I used my clipboard thing at the end, because you don't really do much writing and stuff like that. I used my stethoscope because I did a head to toe assessment. I did use my compression socks. Highly recommend you get those, because those 12 hours were killing me out. My legs were cramping. I don't know, it's because I have sickle cell, so I already have a blood disorder or whatever, and I get like calf pain sometimes. So just being on my feet, I was just like, let me just, get the compression socks. So overall, you just need, maybe get you a little notebook if you want to write stuff down. This is for adult health 1. It was for the older population, geriatric population. So it's not that much, they all have, a lot of these patients are on so many meds. So if something catches your eye, like I know there's like certain medications caught my eye, I will write it down and research it. So we have downtime to debrief with our clinical instructor and talk and certain things I wanted to like look up. I'm like, oh, why is this? And then he would answer questions and stuff like that. So that was pretty cool. But yeah, I would suggest pen, stethoscope, something to write with, like a little notebook thing, compression socks, comfortable shoes, lunch, because someone did forget to bring lunch and we can't leave the site, especially at the nursing home. There was like, we're gonna leave. So but yeah, that's it. So you really don't need much for clinical. Like, you know, like I feel like there's a lot of the aesthetic online about being a nursing student, and I'm gonna get everything pink. Mind you, I do have stuff that's pink, but I really like pink. I don't just be like, oh, because she got it, I'm gonna get pink. Not saying everybody does that, but I mean, it's like I feel like there's just a fad with nursing. I feel like there's not a lot of people who actually have the heart and the dream of being a nurse, you know? I feel like people know it's a fast way to make money and to pay for your lifestyle. And that's why so many people feel burnt out and are leaving the profession. I'm pretty sure there's people who leave the profession that nursing was their dream, and they found a new dream or something like that. But yeah, I've always wanted to be a nurse. I come from a family of nurses. My sister's a nurse, my mom was a nurse. It's just always been a dream of mine. So, and to work with mommies and babies. I'm really passionate about women's health and how they need to stop killing us, because it's crazy. The stats, especially for Black women, childbirth and neglect and the mortality rate is crazy. And I just have a passion for that. But anyway, I'm ranting. Back to clinical. I don't need all that. Y'all don't need all that for clinical. I'm telling you right now. Bring you some snacks too, because I did have to give me some snacks. But I felt like overall the clinical I felt like I learned stuff, you know, for that population. It wasn't really hard. Patients are funny. Some of them are so funny, and then you get some that are like, but you know, that's life of being a nurse. You're gonna get patients that don't like you, don't even want you, will request someone else instead of you, and it just is what it is. But yeah, guys, I think that's all I have. Adult health, you just really want to brush up on your anatomy, patho for the OA. Not trying to give too much because I'm not trying to get in trouble, but you know, just utilize YouTube, Nexus Nursing, Nurse Sarah on YouTube. Brush up on patho, you know, like med search stuff, like do stuff like that. Use the Saunders books that we have, the questions, Quizlet, yeah, to help you with that. But yeah, guys, if you have any other questions, feel free to comment below. My YouTube channel is growing. We reached 1K, which I'm excited for. Thank y'all for following me. And if you haven't followed me yet, I encourage you to do so, because I be dropping gems, y'all. But anyway, I will talk to y'all later. Bye.